washing my hands upon entering the room. Hello there, my name is Alexandra Smith-Stalker. Good to meet you. I'm a student with Texas State University. I'm in the Family Nurse Practitioner track of Master's Nursing Program, okay? I'm going to go ahead and conduct a head-to-toe assessment. So here we have a 59-year-old male, appears to be in no apparent distress, even respirations and everything noted. Upon shaking his hands, I observed and felt firm hand grip and strength. If I could go ahead and shake your other hands, and it is equally strong to the right hand there. Now I'll go ahead and just palpate your skin and the hair and scalp on your head. No abnormalities noted, no lesions, no bumps, even distribution of the hair. Palpating the occipital nose. Okay, and then the frontal sinuses and the maxillary sinuses. Very good. Next, we'll go ahead and see if you can distinguish between sharp and soft objects to the three trigeminal, to the three spaces where the trigeminal nerve innervates, okay? And you just let me know if you feel hard or soft, or sharp or soft, okay?
Sharp. Sharp. Soft. Soft. Sharp. Sharp.
Very good. The patient was able to distinguish between sharp and soft to all three areas that the trigeminal nerve innervates. Alright. Next, if you can remove your glasses for just a moment. Very good. And I'll palpate the external structures of the eyes. Very good. You can go ahead and put your glasses back on. Okay. Next, I will be assessing Perla and directing consensual response. We would perform this on both eyes. I will just do one at this point. Pupils equal round, reactive to light, 3 millimeters in diameter, and brisk accommodation to light as well. And we'll assess for consensual response. The right eye also same findings to the right eye, pupils equal round, reactive to light. Okay. Alright, and we'll do the corneal light reflex. The light reflects at the same point on both eyes, as to be expected. Okay, next I'm going to have you just follow my finger, okay? Okay. And convergence noted. And then, if you could follow my finger once again, assessing the 6 cardinal fields of gaze, that is cranial nerve number 3, 4, and 6. Any pain noted? Alright. And then I'll go ahead and have you frown and puff out your cheeks. This is assessing for cranial nerve number 8. Very good. That was all intact. And then if you could go ahead and press your tongue to the side of your mouth, and again, and equal strength noted there as well. And I'll go ahead and palpate the thyroid. No enlargement noted there, and if you can swallow. Very good. Alright, next I'll go ahead and have you take a look at my finger here, and then once I remove my finger, then go ahead and focus on the wall back there, okay? And accommodation noted there, and we would perform this just once because that's assessing both eyeballs at that point, or both eyes. Alright, next we'll go ahead and assess do the fundoscopic exam of the eyes using our ophthalmoscope. Do not have one currently, but we are assessing for the red reflex on both eyes. We are assessing the cornea, the sclera, the iris, the vessels within the eye, the optic membrane, making sure those are all clear, intact, and no abnormalities noted. I'm assessing the conjunctiva now. It's clear, no exudate noted. And that would conduct the fundoscopic, that would be the fundoscopic exam in full. We'll go ahead and assess the nose, first the nasal ridge and the soft tissue around there for any abnormalities, lesions. There's full symmetry noted. If you could go ahead and sniff for me. Nose is patent, that is cranial nerve number 1, and then I'll take a look inside your nose just to assess for patency there as well, any lesions, obstructions, deviation of the septum or anything like that. None noted. Alright, next I'm going to go ahead and conduct the auditory exam, but first palpating the external structure of the ear. No lesions noted, no excessive redness or warmth, and then also palpating the mastoid process. Very good. Alright, using my otoscope, I'm going to visualize the external auditory canal. In adults, we pull upwards and back. In pediatrics, then we pull downwards and back just because of the shape of their auditory canal. Observing the auditory canal for any exudate, abnormalities, foreign objects, buildup of any sort. Accessing the tympanic membrane, it is shiny, gray, pearly, light reflex is present. Alright. And then we will go ahead and conduct the Weber test with my tuning fork. I'm going to hit this and then place it on the top of the head. We are assessing for lateralization. Does it sound the same? And vibrations the same as well? Very good. Alright. So no lateralization present there. Next we'll go ahead and conduct the Weber exam. I'm going to whisper a few words behind either ear and you. So just repeat back to me what I said, okay?
Square. Pizza. 3.
Good.
Horse. Flower. 7.
Very good. Alright. And then if I had a Schnellen chart, I would also perform the Schnellen exam. Just to see, check for visual acuity. Okay, next I'm going to go ahead and just assess the lips, pink, moist, good turgor. And if you could go ahead and open your mouth for me and say ah. A uvula movement, tonsil, patient had tonsillectomy, so tonsils are not present. However, if tonsils were present, I would grade them on a scale of 1 to 4. And for symmetry, if you could open your mouth again, just let your tongue rest on the floor of your mouth. Just rest. Very good. Tongue is symmetrical, resting on the mouth with no deviation to one side. And that is cranial nerve number 12. And then if you could stick out your tongue, no deviation, tongue protrudes straight down the middle of the patient's mouth. And that is assessing for cranial nerve 10 and 9. Alright, I'm going to observe the oral cavity for any lesions, the buccal mucosa, the hard and soft palate, those are intact and fully formed. Assessing all teeth, good dentition, all teeth intact, gums as well, no bleeding or lesions noted. Alright, and I already had you swallow previously. Okay, next I'm going to go ahead and auscultate the carotid artery and the temporal artery one at a time, and I would perform this on both sides. No bruise noted, No breweries noted to the carotid, and I'm going to observe the neck. No symmetry, no jugular venous distension noted. Trachea is midline, and no lesions or abnormalities noted to the neck or trachea. Next, I'll go ahead and palpate the sinuses, starting with the posterior auricle, post-auricle sinus nodes, pre-auricle, tonsillar, submandibular, submental, superior chain, deep chain, posterior chain, supraclavicular. Alright, and if you could go ahead and open your mouth and close it and shift your eyes. Okay, no TMJ abnormalities noted. Okay, next I'll go ahead and assess the carotid artery one at a time, 2+, not bounding or anything like that. Regular rhythm there. And if you could press your chin against my hand. Very good. And then once again on this side. Very good. Alright. So equal strength noted then, and you can go ahead and shrug your shoulders. Very good. Even shrug, that is assessing for cranial nerve 10. Alright. Next we'll go ahead and assess your posterior chest wall. First I'm just observing for any abnormalities, any lesions. If lesions were present, I would assess for asymmetry, assess the border, assess the color of the lesion, diameter, and if there is any exudate present, but none are present. Posterior chest wall appears to be normal on observation. No heaves noted, no dyspnea noted. I'll go ahead and have the patient breathe deeply for me. Symmetrical expansion of the chest noted there, and then I'm assessing for tactile firmness. I'm going to put my hands on your posterior chest and just say, repeat 99.
99.
99.
99.
Very good. No tactile firmness noted. Now, so next I'll assess for CVA tenderness. Any tenderness there noted, and we'll percuss. Very good. Alright, next we'll go ahead and listen to your lung sounds on the posterior chest wall. Deep breath. Lung sounds all clear and present, no rails, wheezes, crackles, or diminished lung sounds. And then I'll go ahead and listen to the lung sounds on the lateral lung sounds. There are only 2 on this side. Deep breath. And 3 on the right hand side. Lungs are also clear there. Alright, I'm going to go ahead and take a listen to your lung sounds on your anterior chest as well. And I'm going to go ahead and just palpate at least 4 regions of the anterior chest. abnormalities noted there. Symmetry upon respiration noted on the anterior chest as well. Next I'll go ahead and have you lie down for me, okay? And then I'm just going to observe the chest at rest while patient is supine and feel for the PMI. Regular rhythm noted on palpation. Okay. And I'm also going to have you go ahead and lift up your head for me if you can. No distress onto the face, and abdomen still appears to be symmetrical. You can lower your head and rest the head again. Abdomen is flat upon observation from the side, not scaphoid, rotund, or protuberant. No pulsations noted. Umbilicus is intact. No hernia noted. Okay, now I'm going to go ahead and listen to the 5 heart sounds, starting with the aortic. We are headed to the second intercostal space on the right hand side. S2 is louder than S1 at this point. Rhythm is regular. The pulmonic area, second intercostal space on the left. Erb's point is third intercostal space on the left. S1 and S2 are now the same, or at the same volume level. Tricuspid space, the fourth intercostal space. S2 is now louder than S1, and midclavicular fifth intercostal space should be PMI. S2 is significantly louder than S1 at this point. Rhythm is regular, no abnormalities noted. And I would auscultate all of that areas with all 5 of those areas with the bell of my stethoscope as well. Next, I'll go ahead and listen to the aortic artery, listening for any bruits, none noted. The renal arteries, the iliac arteries, and then I would also listen to the femoral arteries and palpate those regions as well, and palpate the inguinal nodes while I'm in that region. I'm going to go ahead and listen to your bowel sounds, starting with the right lower quadrant. Bowel sounds are present and active. Next, I'll go ahead and percuss for tympany in all 4 of the bowel regions. Tympany present, and we'll perform light palpation. And then deep palpation, going a few centimeters deeper. No pain noted upon palpation, no nodules noted as well. I'll go ahead and try to palpate the liver. I'll have you take a deep breath in and then exhale. I was not able to palpate the liver, and we'll do the same thing on your left-hand side. Deep breath. Was not able to palpate the spleen, no organomegaly noted. Alright. Next, if you could go ahead and slide further down so that your knees are at the edge of the table, please. Very good. Alright, now I'm just going to assess for musculoskeletal strength. If you could press against my hand here, very good, and bring this leg back down. Press against my hand once again, and at rest. Bring your toes up to your nose, and toes down. Okay, full strength noted. I would perform all of these exams to both legs, and then I'll go ahead and assess for crepitus. Just relax your leg. Okay. No crepitus noted. performing extension and flexion of the knee, and extension and flexion of the hip, external and internal rotation. And if you could rotate both of your feet for me, just in a circle, very good. All right, and then I'm gonna grab your foot for a second, and external and internal rotation. All right, no lesions or asymmetry noted to the lower extremities. Feet are warm, skin is dry and intact. No clubbing noted to the extremities, no pretibial edema noted to either lower extremities. Let's see, capillary refill is brisk, less than 1 second. Toes are within normal limits for ethnicity. Assessing for the Babinski reflex. Babinski reflex was negative, no flaring of the toes. Next we'll go ahead and assess the posterior tibial pulse. 2+, not bounding, regular rhythm, and the dorsalis pedis. 2+ as well. And then while I'm down here, I'm going to go ahead and assess the Achilles reflex. Achilles reflex present to both sides. We would perform the same on both sides as well. And the patellar deep tendon reflex. Patellar deep tendon reflex is present as well. Alright, and then, sorry, if you could scooch up towards the top of the table again. We are going to assess the page. So I'll kind of guide you. Well, let's see. I'll have you bring your heel to your knee and then down your shin. And do that on the other side. Very good. No difficulty noted. Very good. All right. Okay, you can scooch towards the edge of the table again for me, please. Okay, very good. And if you could go ahead and move your hands, very good. First, assessing the undersides of the hands. No lesions noted, no abnormalities, and no peripheral edema to the upper extremities as well. Symmetry noted also. No clubbing to the fingers, brisk capillary refill, warm, dry, and intact skin. If you could go ahead and squeeze my hands. Good equal strength. And I'm going to push you, resist. Very good. I'm going to pull, resist. Very good. Equal strength noted. And then I'll have you just do rapid motion like I am. Very good. All right. And then I'm going to have you touch my finger, touch your nose, and then back to my finger. Very good. We perform that on both sides. All right. If you could go ahead and flex and extend your elbows. Very good. And then rotate, internal, external rotation. Rotate your wrists. Very good. Up and down there too. Very good. And then spread your fingers. Keep them out wide. I'm going to... Very good. Okay, and then if you could bring your arms out, and then we're going to do some adduction. Just follow me on these motions, and then abduction, and bring them behind. Very good. Full range of motion noted. No difficulty present. And then we'll go ahead and assess your pulses to the upper extremities. First, your radial pulse. 2+, present, regular, and the brachial pulse, also present, 2+, and the axillary lymph nodes. And then go ahead and wash my hands. All right, and then I'm going to assess the deep tendon reflexes of the upper extremities. First, the brachioradial deep tendon reflex. Brachioradial deep tendon reflex present, and then the bicep deep tendon reflex, and the tricep deep tricep deep tendon reflex present. Alright, next if you could go ahead and stand for me, okay? Okay, and then stretch out your arms if you could. Alright, and then close your eyes. This is assessing the Romberg test. No faltering. Patient did not sway from side to side. You can open your eyes again. Patient stood without, and you can bring your arms down. Very good. Stood without any difficulty. And then I'll go ahead and have you walk towards the wall. Just regularly. Very good. Normal gait noted, and then if you could turn around and walk back heel to toe. Very good. And then head back to the wall, walking on the balls of your feet, and then walking on your heels on your way back if you could. Very good. All right, now I'll have you go ahead and face away from me, and then if you could bend. Alright, scapula are even. I'm going to palpate the spine for any pain or deviation. Spine is straight and the iliac crests are symmetrical as well. Alright, you can go ahead and rise for me. And then face me once again. We're going to lean back some. Very good. And then twist one side. And the other, very good. All right. Okay, well thank you, sir. That concludes our head to toe assessment. I appreciate your time.
You're welcome.